In today's Health Smart, we're talking about the looming flu season.
And doctors are now bracing for new challenges amid the COVID-19 pandemic. And joining us now live via Skype with more is Dr. Nicholas Testa, Chief Medical Officer for Dignity Health, Southern California. Thank you so much for joining us.
Thank you for having me.
Yeah, I know you guys have been so busy with the coronavirus and everything that comes with that. And now, pretty soon, we're going to have that upcoming flu season. How are you guys preparing for it?
So one of the ways that we prepare for this flu season is we look at what happens in the Southern Hemisphere, right? So how bad was their flu season, right? Because it alternates from the Northern Hemisphere. And what we saw in the Southern Hemisphere was actually a much more mild flu season, which probably was secondary to such profound social distancing and measures that are in place. So as we prepare for this flu season, there's really two main things we need to do. One, we're going to need to keep this press on around social distancing for a little bit longer through flu season. And then also we need to start preparing our patients for flu vaccines.
All right, for those who don't know, is it possible to get flu and COVID-19 at the same time?
Yes, you can definitely get the flu and COVID-19 at the same time. There's been a little bit of research that was out there. There was a study done out of Stanford, but they only had about 20 patients who were co-infected with COVID-19 and another virus. So the data about how it impacts is still totally unknown.
So in terms of symptoms, how will we know in the future to figure out, do we have the flu, do we have a cold, or do we have coronavirus?
Right. It's going to be really difficult because the majority of the symptoms associated with both the flu and the coronavirus are the same. Probably the biggest difference is with coronavirus or COVID-19, you lose your sense of smell. We don't typically see that with the flu. Other things that you can be cognizant of, which are a little bit more difficult to identify, is with COVID-19, your symptom onset tends to be later, about 5 days after your exposure. With the flu, it's usually 1 or 2 days. And the other key thing, which isn't so much around symptoms, but key to remember, is your ability to shed the virus with COVID-19 is much longer. It goes to 10 to 14 days. With the flu, it's only about 7 days.
All right, well, coming up in a couple of months, people start getting flu shots. Do you expect a bigger surge in demand?
Yeah, well, I hope so. I hope everybody gets the flu shot this year and we see a bigger surge. The country's ramping up for it. When I was looking at the statistics today, there's over 20 million additional flu shots being prepared. So that puts the number at about 195 million flu shots that will prepare for the population this year.
Well, you talked about the Northern and the Southern Hemisphere and the light caseload. Do you think a lot of that had to do not only with distancing, but also hand washing?
Yeah, all the measures that we have put into place, hand washing, social distancing, and then the one that I'm always a big fan of, if you're sick, stay home. I think our society is finally starting to get that. If you're sick, stay home and isolate. Okay,
so when should people be getting vaccinated?
Good question. So you'd think, right, that, well, let's ramp up now. Let's get everyone started vaccinated now. The CDC is actually recommending that we follow the same timeline that we typically follow, which is vaccines really start in September and October. We don't want to vaccinate our patients too early because the flu vaccine tends to wane over time. So if we capture the population too early, particularly the older population, we may not protect them through the whole season. So really, September, October, that's the time.
All right, Dr. Testa, thanks for joining us today.
Thank you.
Thank you. Thanks for having me.